Here are 5 things your care team wants you to know about syphilis. Syphilis is caused by a bacteria and is a sexually transmitted infection, or STI for short. In this video, let's break down what's most important for you to know to feel informed and confident about your sexual health. We will talk about how syphilis is spread, symptoms, how syphilis can affect your pregnancy, how you get diagnosed, and how to treat and prevent syphilis. Syphilis spreads from person to person with direct contact with a sore. Syphilis can spread during all forms of sex. This includes vaginal, oral, and anal. You cannot spread or get syphilis from things like toilet seats or sharing eating utensils. Many people with syphilis don't know they have it, but let's talk about some symptoms to pay attention to. There are different stages of syphilis that happen depending on how much time has passed since exposure. Primary syphilis, or the first stage, usually lasts between 3 to 6 weeks. It involves a sore that develops where the bacteria enters the body. This could be the outer genitals, inner vagina, rectum, or mouth. You might not know you have a sore because it's usually not painful. Secondary syphilis involves a rash 2 weeks to 2 months after the sore. If you have darker skin, the rash might look lighter than your other skin. It can be anywhere, but is often on the hands and feet. You might have other symptoms during this stage too, like fatigue, headaches, or fever. The hidden stage usually happens after the rash goes away and might be as short as 1 year or as long as 20 years. You don't show any symptoms during this stage. Most people with untreated syphilis don't develop tertiary or the third stage of syphilis, but it can affect many different parts of your body, like your heart and brain. If someone has syphilis while pregnant, the infection can be passed to their baby and have serious health impacts on things like their bones, brain, and skin. This is called congenital syphilis. One of the most important things to know is that congenital syphilis is preventable because we can easily treat moms who have syphilis in pregnancy. One of the best ways to know if you have syphilis is to get tested with a small blood sample. You will likely get tested at your first prenatal appointment, during your 3rd trimester, and possibly at the time of delivery. If any of your tests are positive, you'll receive treatment at your appointment. Like many other STIs, syphilis is treatable with antibiotics. If you recently received a diagnosis, you might have already been treated, but you can still get reinfected, so talk to any sexual partners you've had so that they can get tested and treated too. There are many ways that you can protect yourself from getting syphilis. One of the best ways is to use a barrier method with every partner every time you have sex, even if you're already pregnant. Barrier methods are things like condoms, including internal female condoms, or dental dams. Syphilis can still be spread if someone comes into contact with a sore that is not covered by a barrier method, so be sure to ask your partner about their sexual history. And if you have concerns, ask to be tested. We've talked about 5 things you should know about syphilis, including how important testing and treatment are, as well as having open conversations with your sexual partners. Your healthcare team is here to support you, so don't hesitate to reach out with any questions or concerns.